Hello. So let's discuss the medical uses of gold. As we know that the gold complexes are very much important in medicine, and gold compounds have been used for medical purposes. Gold ions are used in in this range. There is a in dental problem to prepare crown or the bridge. Alloys of gold and platinum. Used as coating, used in coating biological specimen. The isotope of gold. Nuclear medicine. In some cancer treatment also. And other diseases. More important, gold is used in the treatment of rheumatoid arthritis. Gold has been used in drug and as anti-cancer agent. So these are the important medical uses of gold. Now let's discuss the anti-HIV activity. Gold complexes. So let's discuss the anti-HIV activity of gold complex. For that, we are going to discuss what is meant by the chrysotherapy. The use of chemical containing gold for treating diseases like chrysotherapy is nothing but the use of chemical containing generally the mostly gold complexes for treating diseases. So is the difference between the chrysotherapy, there will be the two therapies, that is chrysotherapy and chemotherapy. In chemotherapy there will be the use of agent in treatment of diseases like anti-cancer agent. The use of in chrysotherapy, the use of chemicals containing generally gold. So this is called as chrysotherapy. Now let's discuss the anti-HIV activity of complexes. Gold nanoparticles can be stabilized with polyethylene glycol, where used to study cytotoxicity and anti-HIV activity against HIV. Goal line of defense. Inhibits the fusion of HIV fusion. They inhibit the viral entry by GP120 and prevent CD4 attachment. Gold-based compound shows remarkable activities against a wide range of clinical conditions and microorganisms. Infections including HIV. Example is Renofin, which results in an elevated CD4 plus cell count in HIV patient. Treated for these are all about the antiviral activity of gold complexes. Now let's discuss what are the anti-tumor activity of gold complexes. It is a first anti-cancer agent with metal, which used as an anti-cancer agent, but there is some side effect of this cisplatin, that is, it is very toxic to the target cells. So it is very toxic for target cell. But the gold complexes shows a remarkable effect in this anti-cancer or the anti-tumor activity. The cisplatin treatment is efficient for several types of tumors. Several types of tumors. Its effectiveness limited. Effectiveness is limited due to its toxicity, due to its toxic side effect, and resistance often leads to occurrence of secondary malignancy is overcome by the gold complexes. Gold is isoelectronic with the platinum complexes, so it shows a remarkable anti-tumor activity in contrast to cisplatin. Gold complexes targets protein but not DNA. Gold dithiocarbamate results in significant inhibition of tumor cell. That is complexes. There are several classes of gold. Gold first and gold second. Compound show remarkable potential towards anti-tumor activity toward tumor cells. Gold porphyrin complexes. Effective towards cervical cancer. Gold complexes are the compounds with bipyridine type ligand. Shows remarkable activity towards ovarian cancer. Chromatolytic gold complexes. Impart stability and increase solubility. Increases the potential towards carcinoma. So these are all the activity of gold complexes regarding with anti-tumor activity. The possible way to reduce oxidation potential below oxygen evaluation, potential is addition of complexing ions like chlorides. Gold oxidize and dissolve as tetrafluoroaurate.